Good afternoon. I'm Dr. John Bender, and this is Kayla. We're here at Miramont Family Medicine, where we will be testing the axodal disposable arthroscope with our patient, Mr. A. Mr. A is resting comfortably. We are not using conscious IV sedation or general anesthetic. The entire procedure will be performed under local anesthetic. And we have basically positioned him in about 60 degrees of flexion, and we'll be using an anterior medial approach to the knee joint today. Let's start with a little bit of A to 9. And we're going to do just a serial prep here of the skin. So we're going to start with just a little bit of some lidocaine without epinephrine. And this is just to numb the tract. I'm using 1 cc. Could buffer it if we like. I'm going to press through. This is just to numb the tract. Now we will bring out the IntraView Scope 90. This is a disposable scope. And then if you would place the trocar into the introducer.
Okay.
Okay.
Do I have to turn it? It's not.
It's not locked.
Here you go. If you'll give me the end of the device. Yep.
How are you doing?
Doing okay.
All right, so we're going in with the camera. Mr. A, can you see what we're doing there? And it's locked. All right.
There we go.
So there's the synovium.
Cool.
So here's where our fluid kind of limits us because we're probably staring right
Yeah,
toward
he's got fluid in there.
like ACL and that, so we may want to withdraw that. Now, I advance into the fluid.
Is that synovial fluid?
Mm-hmm.
Yeah, because we've only really introduced air. So I'll draw some of that out.
Is there any way that I can assist you with that, Dr. Mender?
All right, we're doing good.
Okay.
Need another syringe, Doc?
So right now we're looking at the articular surface of the femoral condyles. And you can see that there's definitely some wear and tear there where the that smooth mother of pearl condylar cartilage has worn, and we're seeing damage down toward the bone. Whereas here, it looks really good. You can see that's nice looking tissue, much healthier. There's a little bit of some petechial damage there, but it's pretty minimal. Here we're seeing some damage, some degenerative changes, and a tear in the cartilage.
And then to aspirate, do you want to grab another? Or
Yeah.
will you keep this in?
You want this bigger one?
That may be too big.
That's definitely your best looking cartilage there. Let's go medial. Start to see a lot more disease, a lot more damage. So here we're looking at the lateral femoral condyle. We can see the cartilage really looks excellent and much better shape than we're seeing on the medial side. As we progress down toward the notch, start to see the ACL and some fraying there, suggestive of degenerative disease. And when we get to the medial femoral condyle, there's quite a lot of denuding of the condylar cartilage and also more evidence of degenerative changes as we continue to move more medial. So we've pulled the scope back a little bit, and now we're getting a great view of the underside of the patella. And that again does not show nearly the degenerative changes that we're seeing immediately on Mr. A. I'm just infusing a little bit of fluid here, kind of keep my scope clean. Gives us the best view.
So Dr. Bender, can I ask a question?
Yes,
So
ma'am.
prior to sending a patient to an MRI, is this something you would want to do?
Right. No, this is better than an
Better
Dude,
than an
it's,
MRI.
it's more accurate than an MRI. You're going to get better results. Plus, the patient's going to understand what's going on.
That's beautiful. It's like Jacques Cousteau or Surface of the Moon. I'm going to go ahead and just pull this out and get the water up first. Can. How's your knee feel?
Fine?
Excellent.
I have some calls for you.
Do you have any questions about your procedure?
No, thank you, doctor.
You did great. I'm proud of you.
No, you did great, doctor. Thank you, doctor.
And I like to use what I call a Tucker wrap. And this just uses a little bit of some Coban. It acts as a tourniquet, prevents hemarthrosis. The time right now is 4 o'clock, so take this off at 5 p.m. And your knee should be fine after that.
Thank you, doctor.
Thank you. You're welcome. And that concludes our use of the Interview 90 ambulatory arthroscope.